Hi everybody, this is Rhys Barber from Audiology Associates. Thanks for watching that wax removal video today. Two patients in this compilation video. So you have the first one here was Taylor's patient, the second one is Katie's. So Taylor said this one was a very itchy ear, this one, and Katie's got a big old thick plug of skin to come away on the second video, so make sure you stay tuned for that one as well. But what we can see here is very, very soft wax right at the entrance to the canal. Really common when we're doing the wax removals to find this softer wax for a couple of different reasons. Let me get rid of this mouse. The first is that we tend to advise patients to use a little bit of oil before they come along for their appointment. So a lot of the time the oil will have softened the wax it's coming to contact with, that's the word I was looking for. And the second reason is with baths and showers, you tend to get a little bit of water in there. Most of the time it'll be softening the front end of the plug. So you usually end up with a very, very soft front layer. Once you work your way through that, then with the suction, you'll get to that kind of, that little bit more substance at the back, that kind of thicker, harder wax as well, which is the bit you really want to get a hold of to be able to pull the plugs out effectively with suction. So Taylor's just working the outside edge here. We've also got a little layer of dead skin just at the entrance as well, which is kind of folded in like this, and that's what you can see there, but a little gap at the top. Now to me this looks like the fine end, so I wasn't too sure whether Taylor switched up here, but probably because he's suctioning skin. A lot of the time we'll switch down to the fine end, which is a smaller hole on the tube, and the reason for that is to minimize any risk of clarinetting. If this is your first time watching the video, clarinetting happens when we suction skin, and especially floppy thin bits of skin. It vibrates in the end of the suction and makes a really shrill and very loud whistling sound. So if you come across that, normally you whip that out very quickly. Having the finer end on there, the smaller of the two tubes, minimizes the risk for that. You do still get it sometimes with a fine end, but it's a lot less likely to happen. So that's why Taylor's switched down. So you can see it got a lot of that skin away, and now we've got this kind of front block at the top here. Now that's just very, very loose wax, and then you've got that more solid sort of wall sitting behind it, and that's the main bulk of the plug there. So what Taylor's doing here is sort of rolling this almost. We do that sometimes just to detach it. And I wonder if you'll go bottom. Now there's a gap at the top. Personally, I would go bottom left and pull up to the top right, and that will just help to detach that piece of wax from the canal wall. So let's have a look, see what he does. Yeah, this is exactly what you want to do. You want to, in order to get the plug out, don't forget we've got to detach it from all the canal walls first. So we've got to lift it to make that detachment happen, which is exactly what we're doing here. And let's go back in now. Let's go to the bottom section. Let's see if we can lift this bottom section up here. Can we get a hold of it? Yep, that's nice. That's nice. Oh, and he's got the pull as well. So he's lifted, it's detached, and you saw that whole wax plug come towards the camera there. And that just means we know we've made the detachment. Everything's coming towards the camera. Makes it a lot easier to get out. Now, the only thing that's going to hold us back now is the entrance to the canal. Sometimes that could be a little bit narrower, and it'll hold on as it goes through. But we're just, there you go, a little bit of a wiggle just to help it on its way. So it tends to get a bit stuck at this point, so you've got to give it a little bit of a wiggle to get it out. But lovely plug, and you can see that grey, almost beige colour underneath. That's that layer of dead skin that was holding everything in place. So what are we looking at here? Just this little layer on the right hand side, I think. Now I would probably go over the top and just scoop down like this, which is exactly what Taylor's doing there. And the reason we use that technique, if you do wax removals yourself, you'll kind of know why we do this. But sometimes, apparently a lot of people watch the videos who are kind of wax removal practitioners themselves. I know a lot of my ex-colleagues in the NHS, when they did their wax removal training, I had a few people say actually they watched the videos just to help them out a little bit to orientate themselves in the ear canal. But the reason you do that, if you're new to sort of wax removal, if you imagine if you've got a strip of skin like this, it's just kind of detached on the one side. If you lift, what you're going to do is you're going to lift the skin like that. So what you end up with then is the skin kind of peels down the canal. Now a lot of the time you'll get it so far and you won't be able to peel it any further, because you'll hit that fresher skin and then you've got to shear it off at that point. So what you can do sometimes, what I find is a little bit more effective, is to get your suction tube and drop it over the top here and then draw sideways along it. And when you draw sideways, what you do is you kind of lift the edge into the suction, you pull, and it it kind of, not tears it, but it kind of just takes it off so you don't get that massive pull down to the further back end. Really sorry guys, I talked all over the the ruler shot then. I can't quite remember what the excuse me, sorry, what the measurement was, but if you go back you'll be able to find it anyway. So this is actually Katie's patient now, and the title Katie's given this one, she said that there was a skin, quite thick skin kind of plug or thick dead skin in here. So this is the standard size ulnar tube. There we go. You'll notice the slight colour difference between both removals. So Taylor's looks a little bit more fleshy, it's a bit more yellow. It's down to your light source. So me and Taylor use the older light sources, which is a more kind of white light. And then Katie's got one of the newer light sources, which is a more kind of more warm light. So it's more of a kind of a yellow light than a white light, which is what gives it this kind of slightly different appearance here. Oh yes, my goodness me, now this is going to be now see, I love these ones. These are one of my favorite ones to do, where you've got this kind of mash of dead skin and wax all kind of combined together into a plug, and when you're kind of wiggling this you can see it's kind of all holding together. No, I quite like these ones. I think these and peels, I love a good skin peel, and I love a good eardrum peel as well. That's also another favourite of mine. So what we got now is quite a big chunky old plug. Now sometimes you can add a little bit of olive oil in here. Now I think the reason Katie hasn't done that is look at all those little hairs around the outside edge. Now they've got a really important job. So their job is to stop any bigger bits of dust and dirt getting into the canal. So they form almost like a little net to capture those before they get into the canal. And then the wax's job inside the canal is to pick up any smaller bits of dirt and debris and then carry that towards the outer part of the ear canal so it falls out. Now when you've got these hairs all quite dense around the outside edge of the ear canal, if you go put an oil in there, sometimes it can be a real difficult old thing to do, because what you do is when you put the oil in, it just coats all of those hairs. And because we use an endoscope, so we're going in with an actual little camera inside the ear, which is about this long, it's a little straight camera. We're going in there and we're using a tool in there. A lot of the time that oil will sort of come off those little tiny hairs and they'll coat the end of the camera, and then you get this really bad blurring, so it almost looks like somebody's pouring water over the lens, and it's really difficult to see exactly what's going on. So sometimes the oil can be beneficial because it helps with the removal, but sometimes it can also be a hindrance because it obscures your view. So it's always sometimes with these, especially with these hairier canals, it's this trade-off. You're looking at, well, okay, how much benefit will I get by introducing the oil compared to how much hindrance I'll get with my view? And sometimes I will hold off on the oil until the very last minute until I'm really stuck, and then I'll put it in. But what she's doing here is using the right curette, and she's just clearing this skin plug. And sometimes manual tools work better for these particular skin type of plugs because the suction has only a finite amount of power that you can put behind it. So when you're holding on to the skin really does not want to let go, which is understandable. The last thing you want is for your skin to be falling off. So the skin really kind of holds on to the layer underneath. It really wants to hold tight. So when you're pulling with the suction, there's only so much power you can put behind it, and then you'll lose your suction grip rather than the skin pulling away. When you use a manual tool, so when you use curettage, which is what they call them, using the manual tools, you've got a bit more force you can put behind it, so you can pull a little bit harder on things and get that kind of breaking of the skin coming away. But she's doing well here, and eardrum, you can see, looks nice and healthy. It's a lot clearer there. There's a little tiny bit of wax at the bottom of the canal. She's going back in now with the right curette. There we are, just kind of almost using it sideways to pull this forwards. Sometimes with this as well, if you've got a very thin layer, when you use the curette, you've got to push kind of quite hard down onto it to pull that out. So sometimes what I'll do with these ones now is I'll go back in with a suction tube and I'll lift, because you can sometimes start to lift, then it'll come away a little bit more effectively. You can see just there we go, she's trying to lift that edge. Do you see that little edge pop up then as she pulled it with the with the curettage? There you go, out that comes, Let's get rid of that piece out of the ear. And let's take a look beyond. There we go, looking much better. Ear canal looking a lot clearer. So what's this other side looking at? Very similar on this side. And we've got this lovely gap to that top left corner. So I'm wondering whether Katie could exploit that. It doesn't look like the widest of ear canals, I've got to be honest. And this has definitely had some oil in there. You can see that oil coating those little hairs on the outer portion of the ear canal there as well. So exactly what I was talking about in the last one. Now that may well have been oil that the patient themselves have put in just to use it for a couple of days, but she's got a cracking grip here on this bit of skin. Just lost it as it came out there, but she's wisely dropped back a little bit, because when you pull in the skin, as it starts to sort of unravel, it becomes really floppy. Not always ideal to get a good grip on. Of course, a lot of hair on the outer portion of the ear canal. It's a very hairy canal. So I can see she's trying to maintain the view there, because when you start to pull this out, what happens then is you start to sort of, you're working much further, because you've got to keep the endoscope behind the tool that you're using. So imagine we're looking in this way, so your tool will be here, endoscope will be back here. Now the difficulty when you start to pull stuff out of the ear canal is the endoscope starts to drop much further back, and when it drops much further back, you end up in those little hairs then, in this kind of like forest of hairs. But this is unraveling really well. I'd be really interested to see the ruler shot at the end of this one. There we go. So you can see these pieces are all coming away. Looks like we've got one last bit there just to the right hand side, but left looks nice and clear, centrally looks nice and clear. So just a case of see if we can get to the front end of this plug. There you go, and out that comes. Hit another little bit of oil on the way in, so Katie's cleared that camera off. And there we go. Looking a lot better there. And eardrum looking good. So we've got, my goodness, that's a lot, 8.5 centimeters. So what does that work out? That's about 8.5 centimeters. My word, what is that? Three and a bit inches, 3.5 inches, maybe 4 inches, 3.5 inches probably. Well, there we are, guys. Thank you very much for watching those videos and following all the way to the end as well, guys. Thank you very much for sticking to it to the end. And as always, guys, take care of yourselves, take care of your ears, and take care of one another. And fingers crossed we shall all be seeing you on the next video. Take care, everybody. Bye bye.